bringing the people behind our food to life.
Well, the average person has a problem getting the scientific information. It's often very complex. And the average person has a problem evaluating it because they're not toxicologists. And the average physician as well is usually not highly trained in toxicology. So the question is, how much of a dose of any of these substances are we getting? And that's questionable. Industry often will claim, well, the studies that have been done that show a linkage with obesity are done at doses that aren't real-life doses. On the other hand, we now have a relatively new program called biomonitoring, and it's done nationally, which actually measures the amount of various toxicants in the human body. And it only goes down to age 6, unfortunately. It's called the NHANES study. It's a national study, I think, out of the National Institute of Health. So we have data on how much is in people. The CHE, the CHE, has a great toxic chemical database that you can refer to. Collaborative on Health and the Environment is CHE. And you can have that on your bookmarks, and if you have a substance that you're worried about, look it up, see what they say. And they'll give a pretty good indication that the evidence is strong, or the evidence is weak, or the evidence is suggestive. There are different levels of evidence, and so when you have 1 or 2 studies that suggest something, that sets up the alarm. Other people do more studies and you get more evidence. Science just isn't going to be ever over. A lot of the things that we believed 30 years ago, we don't believe anymore because we've had new evidence. So I think the ordinary person should develop some sort of link that they can go to check out chemicals in the environment if they have questions. We operate by the precautionary principle, which says that if you know there's a likelihood that something is dangerous, the best thing to do is not use it until proven otherwise, rather than use it until 30 years later somebody proves it's been harmful to a population for 30 years. So if people can afford it, the foods that are most highly contaminated should be purchased as organic, and less canned foods, because the cans give us BPA, there's no question of that. Buy soups in boxes, or different packaging alternatives, glass. Make an effort to eat as little processed food as possible, because the processed foods, if you look at the number of chemicals in them, usually it's about 3 inches long. Try to have fresh food, and pay attention to those food companies which are making efforts, and reward them by buying their products. There are some brands of canned tomatoes, for instance, that don't have BPA in the can linings, and it says that. There are very few right now, but if consumers make it clear that that's what they want, then changes will occur.